Radial artery catheterization is something that's not done commonly in this country right now, but it's increasing in frequency. And so we can go in through the wrist to measure artery pressures, and we can put an IV in the upper arm, which is a standard place to put an IV in a vein, and actually put catheters up through that IV and measure the other pressures and compare those and make a lot of diagnoses in that way, all through the arm. Again, easier, much more tolerated from a patient standpoint, because immediately after the procedure they can sit here just like this. They don't have to lie flat, they don't have to be inconvenienced in that way, and it hurts a lot less. A catheter from the wrist requires us to put a band around the artery. We can sit up after the procedure. We can be in a wheelchair. We can walk. We can feed ourselves. We can drink without spilling it all over the front of our shirts. It's very convenient for the patient. And so, more convenient for the patient, safer for the patient. That's a no-brainer in my book. When you're a physician doing these, you need to offer this to your patients. We take the pictures of the arteries, we diagnose the coronary disease, we figure out whether there's problems in the pressures of your heart. We can treat many things through the wrist. When we're done with the procedure, we take out the tube, we put on the band, you get into a chair and you go recover. Right now, from a diagnostic procedure, so you come in because you're having some symptoms and we think you might have coronary artery disease. We do the diagnostic procedure, we determine you don't need a stent. You can go home 4 to 5 hours after the procedure. If you get a stent, if we treat the coronary artery disease, right now the standard of care is we keep you in the hospital overnight and you go home the next day. Locally, we're, as far as I'm aware, the only shop where it doesn't matter who the operator is, what day of the week it is, whether it's day or night. If we can do your procedure for stable condition or an emergent condition through the wrist, you're going to get it done through the wrist here.